Okay. So, continuing with the webinar, this will be downloadable on YouTube. I'll have producer Nick give us the call signs for that, how you can find it. So if you have someone out there that's turning 65, they get 3 months before their 65th birthday, the month of, and 3 months after. That is referred to as the ICEP, or the Initial Coverage Election Period. It's a very important decision they have to make, whether they take a supplement or an Advantage plan. Now, when you take an Advantage plan, you are giving up the right to use Original Medicare. You are agreeing to use the network of physicians. So I have many seniors out there that are concerned about particular doctors and hospitals. When you purchase a Medicare Advantage plan, you must agree to use the network of doctors and hospitals, and that's how they work. The reason it's zero monthly premium, it's not free, is because it is funded by CMS with stipend money, with your Medicare dollars. The Medicare money goes from CMS to the carrier. The carrier, therefore, takes on the liability of paying the claims. Now, one of the things I believe is that Anthem got so many members that they grew. The reason they would get out of the industry as far as the Medicare Advantage plan or raise their $0 to $28 was one move, in my opinion, is to stockpile money. So anyone they can retain that'll move from the $0 to the $28 one, that's great. They're still going to get the stipend from CMS. By removing the people on the LPPO, it was just too good to be true. It was a one and done. They gave 0 prescriptions, 0 copay to the primary care physician. Their rates were just incredible on the payout systems. They had a little trouble getting Waterbury Hospital in the network, but they finally did around late February 22nd to be exact, but who's counting? So anyway, there were some problems with the network originally, but once they got those things ironed out, it was a claim-a-thon. People were just putting in claim after claim after claim. And I really believe that they couldn't sustain it with their stipend money from CMS. So that's how that really happened. Are they going to be saving up money and purchasing another insurance company? I bet you they're going to try. We are not allowed to discuss any of that until it's known fact. But I will be watching that merger closely. Anthem is large. They're owned by WellPoint. They're going to be looking to purchase someone in the future. As far as Aetna is concerned, they have a very strong plan this year. They are doing everything they can to get members. United Healthcare has a strong plan. They are having a little doctor trouble with Dr. Kegi. Dr. Kegi is a rock star when it comes to orthopedic surgeons as far as hips. And John Kegi, particularly, Chris Stapp, it's still showing that he's in network, which I believe is his uncle. But I personally know Dr. Kegi. He did both of my mother's hips. And I know Heather in his office. She is incredible. So she's compassionate, and I'll never forget Dr. Kegi doing both my mom's hips at the hospital. So anyway, I like the guy. I have a lot of respect for him. What he doesn't like in particular is the rate of reimbursement that United Healthcare does. So that's when you get into a contract negotiation problem. Contract negotiations are here, and they're going to be here to stay. It's one big company saying to another company, in this particular case, it's a doctor or a hospital, but they're saying, look, we want more money, and the other one pushes back, and then this one pushes back. Contract negotiations mean that out of every $100 billed, about 81 to 83 are going to be paid back. All right? So that's how that happens. As far as the webinar is concerned, you can always make sure you email me questions. Producer Nick will take care of that. But you've got the general concept. This show is only an hour long, so I can't do the full thing. But you've got Original Medicare, A and B. 2 types of C, whether it be a Medicare supplement, which is usually more expensive. You have to pay for that. A good one runs around $250, $253.50 to be exact, a month. You must purchase a Part D unless you're a veteran, or if you've retired from somewhere that has a credible Part D, then you don't. But most of us Americans have to purchase a Part D. With a Medicare Advantage plan, you purchase both of those products in one product. It's usually a much lower premium, such as $0, $28. Connecticut has a great POS plan. That's $24. United Healthcare has a PPO, preferred provider option, that is $20 a month. It didn't go up. So the Advantage plans, you know why they're cheaper. It's your money. There's a stipend given to the insurance companies, and therefore you agree to use the network of hospitals and doctors. All right. I have a lot of clients calling the Western Connecticut Agency on Aging. My friend Daryl Willenbrock over there is doing a phenomenal job. Not everyone is aware of the QMB program. It doesn't hurt to apply. So if anyone has a question, you call in. We'll get you hooked up with them. If your income limits are $27,000 or lower for a single or a widow, and $38,000 change for a married couple, you can qualify for a Medicare savings program. It's something that you should do. 203-757-1320. You know we never give your name here on the radio, so we're HIPAA compliant. Last week, the client, Patricia Harity, did a great job from AHEC, and we said no names for HIPAA, but she volunteered her name because she's the recipient of some Miles for Smiles grant money. And if you haven't seen the video, you have to watch it. Producer Nick did a great job. He even got like the Miles for Smiles logo in the hands. If you have a cause out there that you need help with, I hope the dyslexia race went fantastic last Sunday for my friends up in Town Plot. I saw their sign on the church, and I hope that went well. As you know, I'm going to the Salvation Army Kettle Breakfast. Richard and Jenny are so nice to me. I'm going to that. I believe it's on November 3rd. My friend Kathy Dalton is chairing that. Also, the Office of the Healthcare Advocate. This is when you feel that you've been wronged. And this has been happening a lot lately. The insurance companies want to say, no worries, Producer Tom. Take the call. You're a busy guy. All right, so what they want to say is, look, we need help with these claims. We don't feel we were treated properly. The Office of the Healthcare Advocate is a great resource. They are what we refer to as the ombudsman. Producer Tom, can you put that line 1 through first before? Sure. And I'll have you take it, and then we'll come back. Okay. All right. Michael Regan, how can I help you?
Hi, Michael. I have a question on the Advantage plan.
Sure, that's what I'm here for. Excellent.
Is it your opinion that the Advantage plan is better than the supplement?
Okay, that's a nice question, and we are not allowed to comment. Okay. What I can tell you is the honest truth, but it all depends on your situation. If you are healthy and you are not very, very, very affluent, somewhat affluent, but not very affluent, where the $250 is not going to ever bother you financially, you do not have a strong history of major pre-existing conditions. Do you live in the greater Waterbury area?
Yeah.
Is your need to use Yale, New Haven, Waterbury, and St. Mary's Hospital pretty much for your life?
Yes.
How young are you?
Well, I'm calling from my husband. He's 79.
Okay. Is he extremely not well, or is he well?
No, he's basically well. He has, some things like everyone.
Right, but literally...
He's not always running to the doctor, no.
Correct. That's, the honest situation is you can always get back, which is the most important thing you should understand about this. When you take an Advantage plan or a supplement, every year from October 15th through December 7th, you can get back into what you'd like. Does he have an employer plan? Does he have a plan through his employer that he's grandfathered in with?
No. Okay,
great. So you're a perfect candidate for this. If he has a need for Memorial Sloan Kettering, for Dana-Farber on a regular basis, get the supplement all day. The supplement has no boundaries. You can use it in Connecticut, New York, as long as the hospital or doctor takes Medicare assignment, you can use that. if he has a local presence here with local doctors, the 3 carriers that are A-rated this year are United Healthcare, Aetna, A-E-T-N-A, and Connecticut.
Yeah.
So what you're looking at, did you get the Medicare and You book yet from CMS?
I believe so. He has the Connecticut
Medicare Advantage plan.
He has the Connecticut regular, the Medicare handled by Connecticut.
Correct. And
the
it's
80/20.
And he has a 0 premium monthly plan, correct?
Right.
It's called Prime 1, Prime 1.
Yeah.
There's not a lot of changes to that plan. What they did actually is they went up on the maximum out-of-pocket to $6,700, up from $5,600. So basically, he's just on the hook for a little more exposure. Connecticut is doing $255 a day at the hospital for days 1 through 7. Did you see those few changes?
I didn't go through it like that yet.
Okay. Do you live locally within 10 or 15 miles of Waterbury?
Yes.
You can make an appointment, and you do not have to buy anything. You can make an appointment at my agency. You and your husband can come in. We can review everything, give you material, what's out there. The Connecticut plan you are in right now is rock solid. It's a good company. They have excellent provider directory. And as long as your need is not to go out of network on a regular basis, you should stay where you are.
Yeah, that's and the Advantage plan. Would that cover the 20% and the high deductible?
That's the number one misconception. That's why I did the webinar, and I hope people are listening. You don't have Medicare anymore. Okay?
Oh.
The one question people always ask is, and I'll find it, and I know this says United Healthcare, but this is basically a generic concept. So they always ask me in my seminars, Medicare Advantage is still Medicare. Even though Medicare Advantage plans are privately administered, you still have the same rights and protection as original Medicare. So your husband essentially gave up the 80%. United Healthcare, Aetna, and Connecticut agree to take on 100% of the liability. Okay? So you still have Medicare. It's just administered 100% by, in your particular situation, Connecticut. So he doesn't use the red, white, and blue card in his wallet. What he uses is his Connecticut card.
Yes.
Did you understand that?
Yes. Mm-hmm.
Did I explain your question properly?
I think so. Very
Where
good.
you are, as you know, I've been doing this for 2 years now on WATR. The show is great. I've got producers. We've got, where you are is a good place. Do you have a local agent that you deal with?
No, we just...
Someone was lucky to get you. Can you do me one small favor? 203-757-6099. Give my office a call. Make just a half-hour appointment. We will be more than happy to service you. The agent's making $100 a year off of you and not working for it. So the one thing I like to do is make sure I introduce myself to people and let them know that anytime they need us, they can come into the agency. We're open 9 to 5, Monday through Friday, every day.
Thank you very much, Michael.
My pleasure.
Thank you.
All right. Now, Producer Nick, do we have 30 seconds so you can plug the YouTube? Tom, is that copacetic?
I guess so.
All right. Make a move, get in here, plug the YouTube page. All right, this is Producer Nick, no names for HIPAA, but he's going to let you know how to view our webinar. And thank you so much for listening.
Howdy. Previous broadcasts of Medicare and You and this webinar that you're listening to today are available if you go to WATR's official website, WATR.com, and click on the button at the bottom that says YouTube. It's a red and white logo, YouTube. Nice. That is the way of leading you to the Medicare and You YouTube page, and all previous broadcasts will be on there in video form for you to watch at your discretion.
Beautifully done. Beautifully said. Producer Tom, great show. All right, I'll see you next Wednesday. Thank you very much for listening. I appreciate your time.